Hello, my name is Shirley Dunleavy. I'm a physio lead for Gosport and Fareham. During the pandemic, I worked incredibly closely with my OT colleagues in my area and across the Trust to make sure the patients were discharged safely from home and they had all the equipment and the rehab they needed.
Hi, my name's Wendy. I work at Livingston Hospital main reception. I've worked throughout the whole of this pandemic, offering support for patients, patients' relatives and other members of staff.
Hi there, I'm Sam Mojo. I'm the manager of Trinity Ward in Antelope House in Southampton. I've been working throughout the pandemic, supporting my colleagues and ensuring as manager that they are provided with the correct PPE, the guidance, and just making sure that they're receiving the support, so the mental well-being support as well as the practical support to ensure that they're able to continue to provide our service users with the high quality and compassionate care that we as Southern Health provide.
Hello, my name is Jackie and I'm Assistant of the Medical Day Unit, and we have continued to treat all of our patients and help avoid hospital admissions.
Hi, I'm Jackie. During the COVID pandemic, I was deployed to Parkinson's Hospital in Basingstoke, part of the Beechwood project, opening up a mental health ward for people post-COVID and participating in the fit mask testing.
Hello, my name is Emilia Boyageva. I represent our sales company. I'm the housekeeping manager. We provided all the cleaning, catering and portering in Leamington Hospital. We do all the deep cleans and terminal cleans during the pandemic.
Hello, my name is Jane. I work at Southern Health Reception. We've been here every day through the pandemic, answering calls, doing our posts, doing our duties the same as we've ever done.
Hello, my name's Andrew. I work in the CT and MRI scanners. All through the COVID pandemic, we've been working normally, doing our normal hours. We've adjusted the way we work slightly to allow people to be distanced in the waiting rooms, but other than that, and wearing PPE, we've just carried on as normal, been fully open throughout the whole period.
Hi, my name's Bex and I'm a physical health nurse on Kingsley Ward at Mulberry Lodge. And during the pandemic, myself and my colleagues made sure the physical health of our mental health patients was well looked after.
My name is Jeremy Rowland. I'm a consultant psychiatrist in the early intervention and psychosis team in the South West Division, and I'm the medical director and part of the director team in the South West. During the pandemic, as many doctors, our roles have changed. I've enjoyed continuing to work with the early intervention team, and I've become much more involved in the acute pathway and supporting community services in transforming the way they work and creating capacity to manage the pandemic's needs.
Hello, I'm Sandra. I'm Head of Nursing for Fareham and Gosport, and my part in COVID, I actually went out seeing patients face to face for about 5 weeks. They did call us the rusty returners, but we loved it. Thank you so much for your support.
Welcome everybody, and thank you for joining us for our first ever, nearly virtual annual members meeting. So here we are, it's our annual members meeting in a very strange year. In the beginning of the year we achieved a good rating from the CQC, and as the year moved forward we then had to face the challenges of a global pandemic right across the NHS. And as I say, right across the world. So before we start today, we would like to say some thank yous. Thank you to all of our service users and their families for working with us over the past few months through this extremely difficult time. Thank you to the public and local communities for your support and for your generous donations. And thank you to all of our partner organisations who have supported us. Thank you to all of our wonderful volunteers and members, to our governors and non-executive directors. and of course to our staff. You, the staff, have made us so proud. This event is a huge thank you to you for all of your hard work and your continued support of this trust. And thank you for this commitment throughout the year and your dedication to each other and to our patients through this global pandemic. We also must remember those that we have lost. And this annual members' meeting is dedicated to all of you. I have to just take you through some housekeeping rules. So you will all notice that you're on mute at the moment. If you have a question for us, please write it in the chat box and our team will pick this up. The meeting will be recorded, we hope, and available to view on our website. Later on, you will have an opportunity to ask our executive directors some questions, so please submit those questions in the chat box and we'll ask our executives in their live question session, we'll ask her to answer the questions that you've set. In case we do have any technical difficulties, it says here, which we've already had, just be assured that we are recording the whole of this event, and it will be published on our website over the next few days. So thank you very much. This year we have a full agenda following our annual members meeting, the formal part of our members meeting. And our divisions will share their experiences of the challenges their services had to face due to the COVID-19 pandemic. You'll find out more about how our trust supports its Black, Asian and minority ethnic staff. One of our incredible carers, Leslie Brinkman, shares her experiences with the trust. And then finally, you can get a glimpse of our new Depth of Me project, where our patients and carers have created their own photography and poetry to give a powerful voice to patients and their experiences. You'll realise that just now I mentioned the rather formal part of the meeting that we have to go through, where we formally accept and I sign the minutes of last year's meeting. You may remember, if you were there, it was held in Basingstoke. And we have posted the minutes on our website, and I believe it was sent with you in the link and invitation to this meeting. So we're going to go through and just approve them for accuracy. If we've received any comments at all on page 1, page 2, please feel free to write something in the chat box so the team can pick it up if there are, first of all, as I say, for accuracy. Page 3, page 4, page 5 and page 6. And if there are no other comments, then I will formally sign these meetings as a true and accurate record of last year's meeting. Thank you very much indeed. It gives me great pleasure to introduce to you our new Chief Executive, Ron Shields, who started with us in the summer and has made an enormous impression on the organisation and on the relationship that this trust has with its partners in the system. So Ron's going to say hello to you and to speak to you and hopefully impart his wisdom with us. So thank you, Ron.
Thank you, Lynn, and hello and good evening to everyone. We've got staff, we've got members, we've got sort of governors all on tonight, and if you're not a member of the Foundation Trust, then I would encourage you to join. You can actually keep up with what's happening in the Trust, and actually it's a very, very good way of learning about the Trust, but also importantly, as a Trust, holding us to account, holding the Executive and the Board to account for the way in which we meet the needs of the people of Hampshire and the Isle of Wight. I am new, so I'm not going to be looking back at the previous year, but I am sort of very, very pleased to have seen what the Trust has achieved. But since I started in June, what I've done, I've had the privilege of being able to listen and to see just what it is that Southern Health does across the whole of the county, in all of our services and all of our teams. I've been incredibly impressed by what I've seen, the services and the quality of the service that's being delivered. But more than that, what delivers good service is the passion and the commitment of the people who work in this organisation, but also the people who support us, people in the voluntary sector, our governors, volunteers and others. The commitment of people to work with Southern Health to actually deliver the very best services we can, I think is incredibly impressive. It actually makes me very, very proud to join Southern Health. I have absolutely no hesitation in actually saying that as a service, as an organisation, the services that we provide, there is so much that we can be proud of. But as an organisation, we also learn. We learn from what's not gone so well in the past, and we make sure that that's built into how it is that we then develop the best possible services for the future. And I'm much encouraged by what I've seen of the learning in this organisation and the extent to which we want to hear directly from the people who use our services, and we want to hear more from the people who provide the services, our staff and our governors, because that's the way in which we will continue to improve. We absolutely are the main organisation in Hampshire and the Isle of Wight for providing community and mental health services, and bringing those together is about promoting the physical and the mental health, the physical and the mental well-being of everybody in our population. And there are so many ways in which we can do that. We want to actually know from you, as the public, as our governors, as our members, what it is that we can do better. But I know that the staff in this organisation are absolutely committed to driving on to be the very best services that we can deliver. So I am very proud to be here, and I am confident that Southern Health, with all of our partners, will develop a very positive future in terms of how we deliver health and care in this county.
If you wouldn't mind me asking you some questions. So what's the most, when you've been walking around the services, what's the thing that you found most pleasing as a new Chief Executive?
It's always the enthusiasm and commitment of staff that, you know, however difficult it is, and times have been incredibly difficult trying to, as we learn about COVID, as we work our way through COVID, as we adapt our services, staff are still focused on every aspect of what they're trying to do to make it the very best possible experience for all of the people who use our services. And yeah, the innovation that comes with that, when you consider that, you know, the hours that people work, the days that people work, the shifts, the extra work that's being done, and the emotional strain as well, you know, coping with people who are very unwell normally, but also the support that, well, the way in which actually COVID has been taken on board. You know, we were learning as we went, applying the very best knowledge that we had about control of infection, but taking it into services in ways that we've never done before and at a scale we've never done before. And that's just incredibly impressive. But it's that just commitment, absolute commitment of staff, and how enthusiastic and positive they are.
They are amazing.
They're just great people.
Yeah, absolutely. Yeah, wonderful. Thank you. And so that's what you've noticed most about the organisation that you're working in, but you're also working within the system across Hampshire and the Isle of Wight. And how have you found the plans that are in place to take this county forward for the future?
I think the plans still need a lot of development, but what I'm encouraged by is that all of our partner organisations, all of the NHS organisations, commissioners and providers, as well as our local authority colleagues, the ambition that there is to actually make sort of Hampshire the best in terms of health and well-being, and put that into the context of people's lives, so that actually it is about supporting people, I think is just fabulous. And what's absolutely clear is there is so much more that Southern Health can be doing as a good partner in the system. And the shaping of that big agenda, the outline is generally clear from the sort of the national plan in that respect. But when it comes down to how we're going to do those things, how we're going to get the best health for our population, what's clear is that people want to work together to do that. So general practitioners, I've spoken with, I think I must have spoken with 120 GPs, I should think, so far. And you know, they really do want us working with them. They want us working so that the staff who deliver our mental health and our community services, as well as the services that acute colleagues provide, some of which could be provided in the community, what's absolutely clear is that we're building that around the new primary care networks, the groupings of GP practices, and that's really exciting, you know. But the challenge to us as an organisation is probably how we have less silos and less divisions, how we actually look at one person who needs a range of supports and how we then organise it for them rather than expecting them to fit in. And that's the challenge for the whole system.
Wonderful, thank you ever so much. That's really helpful. I'm going to move us on now back to the video. I understand that we've been able to salvage the video, so let's go back to that. Thank you.
Hello, my name's Paula. I'm here tonight to talk to you about the finances for the Trust in 2019-20. I'm the Finance Director, so it's my responsibility to look after the money and make sure I can explain it sensibly to you guys now. It's been a challenging year, and for those of you that were here last year, you will recall me saying probably something similar. And we have unfortunately had another overspend this year due to pressures, but I will take you through in more detail over the following slides. Some of you will be aware of how the finances are done in the NHS, and we are asked to focus on something called a control total, which is set for us at national level. Unfortunately, we weren't able to achieve this, which we were hoping would be break even, but we actually had an overall loss of 3.4 million at the end of the year. When you look at the accounts in a true accounting way, which includes all sorts of technical adjustments, the deficit increases to 5.7 million. Although this was an adverse position, and we are naturally disappointed with that because of the impact on our cash balances, it was a better position than we thought it would be at month 9. We were really concerned it was going to be probably £3 million more loss than that. So we did have a really good recovery in quarter 4. I'd like to thank all the staff who contributed towards that improvement with their own efforts. Every year it's challenging on the money, and people work really hard to do the best they can with it for our patients. The slides will show the sort of total income values, most of which, as you would expect, is from our local commissioners in CCGs and NHS England, and importantly, the local authority in Public Health England. Our spend was higher this year. We had continued use of out-of-area beds for mental health patients, and it was really important that those beds were found for our patients and that they had the care they needed. But it comes at quite a considerable cost, which we're not funded for, and that fully explains why we were overspent. We also incurred agency costs, and again, from a continuity of care perspective, we'd rather be able to reduce those and increase our permanent staff, and it all has a financial implication. The reason the deficit's important is because it affects our cash, and cash is the thing that allows us to spend money on capital. And that's a really important part of what we do and how we improve our services. I'll come on to more of that in a moment. I mentioned earlier that we every year have to make savings, and I think teams did incredibly well this year to deliver £13.2 million of savings. Some of it was only achieved as a one-off, which means that the requirement still exists in the new year to keep on making savings. That makes it quite difficult. We were really lucky in achieving £4 million of provider sustainability funding, which is the national incentive for hitting your control total, which we did in 3 out of the 4 quarters, which is really good news. If we could have achieved it in quarter 4, it would have been an extra 2 million, but we were not able to. As I mentioned earlier, agency and out-of-area beds, the figures are on the slides, were 2 of the pressures that we received. On areas of improvement, though, we try and make sure that we don't spend money unnecessarily. So things like compensation payments for loss of office or payments to directors that are not on the payroll or external consultants, that spend was really low last year. And we did really well on paying people on time, which as we move into the new year, and I'll do a little bit on this later, paying people quickly, our suppliers, is really important to their cash flow. Our sustainability risk rating with NHSI was a 3, which is not ideal, 3 out of 4, 1 is best. And our overspends on agency and deficit are effectively the reasons why we weren't able to achieve that the way that we'd have liked to. Just to quickly focus on capital spend, as I've already mentioned, a really good year on capital, as in the programme was quite high because of 2 substantial schemes on site at Tatchbury Mount, which are supporting our low secure CAMS patients and our learning disabilities low secure patients. We also managed to do environmental upgrades for fire safety and improvements to reduce fixed ligature points across the trust. We had other property improvements, things like substantial maintenance schemes, and did some transformation and redesign. Technology is always a big investment every year to ensure that our staff have got the information technology systems that they need and the kit that they need, and that was 2.1 million last year. We also, with support from the League of Friends at Lymington Hospital, we were able to purchase a new CT scanner to replace our existing one, which was 10 years old. And that was really exciting, and Lymington Hospital's now got a really top-notch CT scanner, which is fantastic for our patients of the Forest, but also for our staff and our way that we're able to use that machine. There were other smaller pieces of equipment purchased, but that is the bulk of our capital spend. So quite a big capital investment last year, 18.8 million. It was factored into the plan at the beginning of the year. But clearly, cash balances, if you look at a year where there is a deficit and high capital spend, you start to worry about the impact on cash. And we were worried. So at the end of month 9, we went to the department to seek a loan of £5 million to make sure that we were able to support the rest of the year the way that we wanted to. Interestingly, because of a change in the financial regime, that loan has just been converted into effectively an item on our balance sheet now, which means we don't have to repay it, and that's really good news. And that meant that actually at the end of the year, we closed our cash balance at 13.3 million, which, as you can imagine, is higher than we expected because of our financial improvement in Q4 and the loan coming in. But actually, in terms of reduction from the start of the year, it was 7.1 million. 13.3 million as a closing, though, was still 16 days of operating cash, so that was a healthy balance and meant that we've been able to consider a normal capital programme for the year based on the money that we start the year with. The final thing to talk about in quite detail is our charity, Brightaway. As I mentioned earlier, we've had a significant donation from the League of Friends for the CT scanner, which was just under £600,000. But we've also had other donations from League of Friends around the various locations that they are. We've also been able to fundraise, including marathon runs and tea parties and a Christmas fair. And obviously, really importantly, we've been able to spend money on the things that are important to our staff and our patients. We're trying really hard at the moment to develop our charity. Clearly, the response for COVID and the national response to that, as well as local response from our communities, has been considerable. So we know that there's a big opportunity during this year to ensure that we raise really significant funds for the charity and are able to spend those funds on things that are important to both staff and patients. So just to do a quick summary to close on the financial outlook for 2020-21. Obviously a really interesting year because understanding the impact that COVID was likely to have was something we became aware of in February, and nationally we started to work towards how we were to respond to the pandemic. From a financial perspective, what that meant was that all of the time we were spending trying to negotiate contracts with commissioners and working out what our plan for the year was, all of that was paused and is still paused. Because it was really important that as much of our resource as possible spent their time supporting our staff on patient care. So the financial arrangements completely changed, and We've been in a position all year where nationally they've wanted all provider organisations to break even, and that position has been in place from months 1 to 6, so that's where we've been. We've had all COVID expenditure covered by the centre, and that was important because people didn't want people worrying about the money as a reason not to do something, so they tried to remove as many barriers as possible. That's helped our finance team remove any barriers for our staff as well around financial affordability. It's been important to keep financial control in place, and we've absolutely done that. We're now considering how this works for the rest of the year. Clearly, as a trust, we have an underlying deficit position, and this is an amazing opportunity to try and eliminate that this year before we get back into the sort of normal swing of things next year. So our teams right now are focusing on how we eliminate underlying deficit. Important part of that has been the work that all of our local teams have been doing on reducing the use of mental health placements out of area, and they've made incredible progress on that to the benefit of our patients, which also has benefited the money. We're working with system partners to work out what the response now looks like for the pandemic. So for now until, well, at least next spring, we're obviously considering the impact of winter and the impact of COVID. And what are the services that we need to do that, and what's the financial implications and funding requirements for that? So that's the work in progress at the moment. Clearly, reducing vacancies continues to be important, and that will have a massive benefit on our staffing. So normally in this slot, I'm talking about what we're doing to try and, solve the SIP and all sorts of things like that, and how the new year's going. In a way, it's going better than it normally does, but it's because the financial regime has changed, and what we're trying really hard not to do is take our eye off the underlying position to make sure we start next year in a much stronger position. I know it would be incredibly helpful for our teams if they could be really clear on how much on their affordability and how many staff they have that's funded by our commissioners to run our services, working really hard internally and externally to do that.
As Ron said to us earlier, Paula's presentation will now be followed by our external auditor's report, and Sasha Lewis from PricewaterhouseCoopers will present that report to us.
Hello, my name is Sasha Lewis, and I am the Audit Director for the Southern Health External Audit. PwC is appointed as the Trust's external auditors by the Council of Governors. Our audit is governed by the NHS Act, the National Audit Office's Code of Audit Practice, and international standards on auditing, and we must comply with the requirements of these regulations. Our responsibilities as the Trust's external auditors include expressing an opinion on the Trust's financial statements, and satisfying ourselves that the Trust has made proper arrangements for securing economy, efficiency, and effectiveness in its use of resources. We are normally required to provide assurance on the Trust's quality report, but for 2019-20, following changes to the reporting timetable and requirements due to COVID-19, we were not required to perform any work on the Trust's quality report. During the audit, we focus on the following significant risk areas. The risk that management could override controls over financial reporting. In accordance with auditing standards, this is a significant risk on all audits. The risk of fraud in revenue and expenditure recognition, which is the risk that revenue and expenditure may be incorrectly recognised. In accordance with auditing standards, this is an expected significant risk on all audits. The valuation of the Trust's estate. This is a risk because the Trust's estate is revalued each year. The valuation is judgmental and based on a number of assumptions, and the value of the estate is significant to the financial statements. The Trust's use of resources. We have issued an adverse opinion on the Trust's use of resources for a number of years due to the regulatory action taken against the Trust. For 2019-20, we also identified a significant risk regarding going concern. This was due to the Trust not meeting its planned deficit for the last 2 years and the uncertain financial position for 2020-21. The 2019-20 deadline for the submission of the audited annual report and financial statements to NHS Improvement was extended to the 25th of June 2020. This is an extra month compared to normal and was due to COVID-19. We discussed our findings from the external audit with the Audit, Risk and Finance Committee on the 27th of May, and the annual report and financial statements were approved by the Trust's Board on the 2nd of June. We issued an unqualified opinion on the Trust's financial statements on the 5th of June 2020. Our opinion included an emphasis of matter due to the material uncertainty related to going concern for the Trust. This was because the Trust might fail to deliver on its financial plan for 2020-21 and require financial support from the Secretary of State to be able to meet its liabilities and be able to continue to provide healthcare services. The extent and nature of the financial support required, including whether such support would be forthcoming or sufficient, was uncertain at the time of signing the financial statements. We also issued an adverse opinion in relation to the Trust's economic, efficient and effective use of resources. This is consistent with previous years and is due to the Trust remaining in breach of its licence conditions, with enforcement undertakings remaining in place, and also due to the unplanned deficits reported in the last 2 years. Thank you.
This next section this evening, we're going to meet our new lead governor, Adrian Thorne. Before I introduce him and before you see him, I would like to just take a minute to say thank you to Andrew Jackman for almost 9 years work as our lead governor here in the Trust. So a huge thank you to you, Andrew. So over to Adrian, who's going to talk to us about his role as the lead governor and how he sees things here in Southern. Thank you very much.
Good evening, everybody. Welcome to our annual members meeting. My name's Adrian Thorne. I am the lead governor for Southern Health. I've been lead governor since the 24th of July this year, so not in post very long at all. I have, though, been a governor with Southern Health since 2016, and I'm an appointed governor for Carers Together. I'm going to start off by giving some thanks to a number of people. Firstly, I'd like to thank Andrew Jackman, who was lead governor for a number of years up until July. I think Andrew is a guy that I've got to know very, very well over the years. And I remember a couple of AMMs ago, the chief executive said that it was like managing a disparate group of people. And Andrew managed to do that in a really professional way. And I think he brings the team together very well. And I think he'll be a very hard act to follow for me. I'd like to say goodbye to governors that have left us during the year. Thank you very much for all the service and support that you've given us. I'd like also to pay tribute to Nick Broughton and thank him. He left a few months ago. He came to us at a time of great difficulty, and I think the work and the leadership that he showed the Trust has got us to where we are today. So for me, a personal thank you to Nick. I'd like also to welcome our new Chief Executive, Ron Schultz. I look forward to working with him and looking forward to us progressing as we have thought about and where we want to get to in the future in terms of being excellent. We also have a number of new governors that have begun during the year. I won't go through them all, but I'd like to welcome them all and look forward to all of their contributions as we move forward over the next period. The pandemic has been a challenge, as we all will know, and I want to thank our staff for everything that they've done over the last, since March or probably before that. I'd specifically like to thank our frontline staff. I'd like to thank our support staff. I'd like to thank those that have returned from being retired to work with us. Thank you very much. And also I'd like to thank those that have been redeployed to different roles during this period. It's been a fabulous team effort, and the governors and the Council of Governors are really grateful for everything that you've done during that period. I think that what I can say about Southern during this period is that the professionalism and the commitment from all of the staff has been outstanding. Moving on from that, I'd also like to thank our chair and our non-executive directors for the work that they've been doing the last year, specifically during the pandemic. The executive team, I think, has stepped up to the plate and led in such a fantastic way, and so I'd like to thank them. We've had lots and lots of volunteers working with us, and I would like to thank them for all of the work that they've done. And finally, but not finally in the sense that this is very important, I'd also like to thank the Mental Health Act review managers that have been working during the pandemic. Thinking about ambitions for the Trust, we have to recognise the journey that we've gone through, and our history is something that needs to remain with us, and we need to recognise that history. We've actually achieved a better score with CQC up to good this time around, which is a great achievement by the staff. We have a quality improvement programme, which I think we need to now roll out in a slightly different way so that we're actually working more with the divisions rather than it being a central-led project. We need to improve equalities. We need to improve our population's health. We need to work in partnership with the economy, both in terms of other public sector organisations, third sector organisations and our stakeholders. And I think we need to actually understand what excellent means to us. And it isn't just about a CQC score. It's about the best services we can provide on a consistent basis across the county. I look forward to working with you all as Lead Governor to make the Trust the best it can possibly be.
In this next session, we were going to take questions that had come through from the public and members and our staff and have the executives able to be here to answer them. Unfortunately, we've not been able to have any questions come through as yet. So if you do have a question, please still put it in. But at the moment, I've got Paul Draycott with me, who's got the largest and longest title in the world, and he'll tell us what that is because I can't remember all of it. But Paul, what I'd like you to do is just share with us, just briefly, what are you most proud of that this Trust has achieved in this year just gone?
Thank you, Lynn. My title is Director of Workforce Organisational Development and Communications. And what am I proud of this year? There's so many things I'm proud of. As you would expect, the response of our amazing staff to the COVID situation, as Ron alluded to earlier, was incredible. And I'm incredibly proud of that whole response of people. But I think there are other things that I'm really proud of. Our staff survey results this year, the way that we have improved the culture across the organisation. We're now in the top third of comparative trust in terms of our staff survey, and that's about our staff leading and leading and engaging in change. It's about our leaders doing, leading in a different way and making sure that staff are at the centre and that they can then engage our service users and carers. And I'm also proud of coming out of COVID, how our cultural insight has shown a 3% increase in engagement across all of our staff. So lots of things there that I'm proud of, but one thing I'm really proud of through the COVID situation and the surge that we had earlier in the year is our response to support our black and minority ethnic colleagues. And I think it's sometimes difficult to remember at the beginning how little support was coming out from the centre and how the little evidence was coming out, and we took that evidence, we worked with the evidence that was available, we worked with our staff networks and our colleagues across the organisation. We came up with a risk assessment process, the wellbeing assessment process that supported staff, and we were doing it well before we were asked to do it, and we'd engaged our colleagues in that. And then following that, our response to Black Lives Matter and our board response to that, and how as a board, we put our hands up. We've got so much work to do. Absolutely. But we want to do it. We've set ourselves some great aspirations. We want to be representative of all of our community at all of levels in our organisation by 2024. Thank you. And I think that whole response was something that I'm incredibly proud of as an organisation.
I think we should be. Yes, absolutely. But we still have a lot to do.
We have loads and loads and loads to do. Yeah.
Okay, lovely. Thank you, Paul.
Pleasure.
Grant, if you're there, can you tell us, as the Chief Operating Officer, what you're most proud of in looking back over this last year?
I feel the thing I feel most proud of, I think it's both what I feel most proud of in my family and my friends, is the same I feel most proud of with our staff and patients, is that in recent months, so since March, I think it's been resilient and working hard at relationships, because I think when you're in a professional relationship and you're working with people's loved ones, patients, service users, the most important thing we do is maintain those relationships and engage. And we all know the strain that COVID has put in our relationships, in our personal lives, and it's the exact same in those therapeutic relationships our staff have, whether that's our community nurses having to care for some of those vulnerable people with their partners in primary care, or it's our mental health nurses caring for people in the most vulnerable state in their life. I think they've remained resilient, and I think they've fallen out and they've fallen back in, and they've reflected things I've done in my life, and you just hear that those relationships have been a bit more challenging, but they've worked together. And I think for anything we do, Lynn, that's the only chance we've got, is if we form partnerships and we work together, both as individuals but also with the broader families and networks.
Lovely, thank you. That's a very important thing to remember.
Yeah.
Thank you, Grant. Thank you very much indeed. Paula Hull, just a couple of minutes from you, if you wouldn't mind. So you're the Chief Nurse?
Director of Nursing and Allied Health Professions.
Thank you. And you are going to tell us in a couple of minutes what you're most proud of that we've achieved in the last year.
Yes, it's been an incredible year, Lynn, and actually the things that have really made me most proud are quite similar actually to what Paul and Grant have already said. It's been about how people have come together and listened to what people are telling them about the services that they provide, even in some cases where that's been quite painful to hear, and they've had to hear that the service that they provide isn't quite what they wanted it to be, but they've embraced that feedback and they've worked together to try and improve. And I think that's all we can ask people to do. I think going out to teams during this time, seeing them working in their protective equipment, on really hot days, knowing they're worrying about their families, but still really showing that dedication and commitment to the patients, the service users, children and families has been really inspiring to me, putting to one side their own personal worries and concerns and fears, and stepping up every day to do that difficult job that they do.
Yeah, okay, lovely. Thank you, Paula. Definitely. Do we have any questions yet from people, please? Can I just you could pass them to me and I can have a look. Thank you. So
from Paula's presentation, one of the areas we've made great improvements in is out of area beds. We struggled with this for many years though. What are we doing differently? Grant, I think this is a question for you.
It's a great question. Do we know who this is from? No? Okay. It's a great question. Grant?
Yes, it is, and I think the starting point is really important to understand is, although we haven't got as many people, we've got no one today in an out-of-area bed that is that we don't contract. I think that the really important point is we've admitted more people in the last 6 months than we did last year, so we're giving more people care in inpatient environments. We're just giving them for a shorter period of time, and the reason we're able to give that care for a shorter period of time is because of the relationships that our staff have with the patients and their extended networks, and being able to work with people so they don't spend a day longer than they need to in an inpatient ward. Admission to our mental health service is really not a neutral act. It interferes with someone's life and with their journey and recovery. Yeah. So it's really important to spend as little time as possible in inpatient wards, and that's what we've done differently. We've worked hard with patients, their carers and loved ones, and with our community staff and with primary care to get people at the right time back home and back into work, and that's what matters. So we've admitted more people over the last 6 months, but they've been for shorter lengths of time, which we feel is really important to support people's recovery.
Lovely. Thank you very much. That's a real good news story. And of course we must not forget the impact that our out-of-area placements had on individual patients' lives when they were sent to far-off places. And whilst what we did was we made a decision that everybody who needed care should receive care, the fact that they were receiving that care a long way away from home meant that it wasn't always a pleasant or valuable experience for them, for which we apologise. We have another question. Is there a waiting time for our mental health services? If so, how many are on the waiting list and what is the wait time? My guess is there are waiting times for all kinds of services, but who's best placed to answer that? Grant again. This is the joy of being the Chief Operating Officer, I guess. Kind of goes with the title.
Yeah, and it's, in some respects it's a relatively straightforward question because as you allude to, it's very different in different places. I think the most important thing is people get triaged and we work with them to decide. Some of our services have more defined waiting times, but the majority of our general mental health services don't. And what we do is we work with the person and hopefully think with them the priority that when they need to be seen, the right care at the right time, the right place. So there's no easy answer like 4 days or 5 days or 10 days. We do see the majority of the people that we care for promptly, and I know some people feel frustrated, Lynn, that it's not quick enough. And that's why, importantly, over the coming year, we're doing some work, starting work with our partners across voluntary sector and primary care to think about the model of community care, and is there a way that we can make the doors wider so more people can get in and we can give access, but not just to our services, to voluntary sector services, to peer services, and what people are waiting for is clearer. Because sometimes people are waiting to see a doctor, but actually what they need to see is an occupational therapist. So I think there isn't a simple answer of it's 5 weeks or 4 weeks like some services, but I think we prioritise it, we communicate with people, and I think more importantly going forward, we need to make sure we've got more choice for people, and I think that's what will matter, that people aren't just waiting for a single thing, they've got choice to have group work or individual work.
Yeah. Okay, that's helpful. But Grant, if you don't mind, sometimes our services are IAPT services, for example. They have long waiting times. Are we able to say that we've done better with those kinds of services, or have we been able to talk to commissioners about better resources? So I think that there's some frustration around those kinds of services.
I think there are. I mean, it's always really difficult, I was talking to a large audience, to say we do better than most. Because actually that doesn't matter to the one person who waits too long. So it's a bit of a trite answer in some respects that we do better than most. We do as well as many, and we do better than most around our services, which are about improving access to psychological therapies. And we continually try and improve that. We work with our partners and So On Mind around our psychological therapy service. But individuals still remain frustrated about that, and we continue to try and do what the Trust is committed to, which is continual improvement. So we learn from anything that isn't the standard a person wants. But sometimes people need to wait a certain length of time till their motivation comes to a place, so they work with us and what the length of time is. But we do well with our waiting times in our psychological therapy services. But acknowledging some individuals will be quite frustrated that they don't feel we meet their needs always.
Okay, lovely. Thank you ever so much. Thank you. Do we have one more? Yes, we do. And this is from Pippa, and it says, we're closing Willow Ward, an inpatient service for learning disabilities. Will this increase out-of-area beds? So, and Grant is saying no. I don't know if he's saying no to coming up again or no to no, it won't. But I'm guessing it's
No, it won't. No, it's a great news story. These are placements for people that shouldn't be in a hospital environment.
Absolutely,
they need to be in a supported environment and as ordinary a setting as possible. It's a really important initiative. We have 2 people who need to be in a more ordinary setting, and hopefully during September those 2 people will go into an ordinary house setting that we live in. So it's great news. I think it's important that we have some service that replaces that, but that would be providing support into houses instead of a hospital setting, Lynn. So it's a really good news story.
Good news story.
It won't drive out their replacements.
There we are, Pippa. So better for patients and
yes, much better.
people getting on with leading normal lives. Thank you. Yeah. Thank you very much. And this is going to be the last one, I think, in terms of time. So this is from Craig, and it says, staff have embraced a new way of working. IT support has been excellent. How can we ensure this remains a priority in the development and delivery of services to increase clinical capacity and be seen as a leader of change? So I think that's for Heather.
It is for me. So Lynn asked us also to think about what we're most proud of, and I have to say, in terms of the response to COVID, the opportunity to develop our digital offer was something I was incredibly proud of, and the way that we were able to mobilise services to work in a very different way, to engage our users in a virtual platform, to make sure that we're able to mobilise the workforce to work from home and be secure and safe in terms of delivering their care in that environment. The digital innovation was an incredibly important piece of our response. So we've done quite a lot of work thinking about how we embed that, and one of the things that we've done and really used kind of the COVID response and people's new found sort of enthusiasm and also experience of using those digital platforms. We've engaged some digital champions and digital leads throughout the trust, and those are embedded now across all of our divisions, and that front line users will be absolute key to make sure that we're driving the innovation that's meaningful. We're also making sure we're doing that based on experience. So, some people's experience of digital will not be the same as other people's, and people have a varying ability of confidence in that. And that not only goes for our staff, but for our service users. So it's really important that we shape our new offer to what people want, and that we listen to the feedback from people. But we also need to think about the system and the interoperability. So, increasingly in terms of the response, we're working across systems with our primary care partners, with our acute partners, and we're working within the Hampshire and Isle of Wight system to make sure that the digital innovation sits within interoperability and we're able to share information across.
Lovely. Thank you very much. It's very exciting, actually.
It's very exciting.
All the things that have happened and all the things that we're now able to do. It really is an exciting time for us. Thank you, Heather.
Yes, thank you.
Thank you. So now I'm going to just say to you that this is now the end of the formal part of our annual members meeting, and your time to grab 5 minutes for a cup of tea and a break